Module 7, Healthcare Skill Development, will build off of the previous presentation on assessing transition readiness. By the end of this module, you will be able to list specific steps for making a healthcare transition plan with students, discuss the FloridaHATs tools with students, parents, and colleagues, and identify activities and tasks for students' transition plans. The student's goal during healthcare transition preparation is to gain the knowledge and skills to manage their healthcare independently. The educator's and parents' shared goal is to support the students with planning, tools, and coaching. Self-management expectations instill in students a sense of responsibility and ownership of personal health. In addition to the health management skills that everyone must learn, youth with special healthcare needs have important condition-specific skills to master.
In terms of balancing my healthcare with everything else I do in life, I'd say that there aren't too many differences between myself and the average person. The average person has things that they have to take care of that no one else does. For instance, if somebody has a child at a young age, and they've got to take care of that child as well, and in addition to taking care of their own life. Well, I kind of have a part-time job as somebody else might with a child, or a full-time job as the case may be, in taking care of my body, and so I might have to take an extra half hour before I go out with friends to make sure I get my treatments done. Make sure I plan an extra hour during the day sometime so I can get 2 sets of treatments in. So I make sure I'm breathing clearly all day and whatnot. So I just have to kind of work in time throughout the day based upon what my requirements are. And everybody's requirements are different. And, but I always just kind of start with how I'm going to do my day anyway. If I have a specific schedule I have to keep, then I work my healthcare in around that schedule. I try not to do, I don't know if this is, normal doctrine from professionals or my mom even, but I try to work my healthcare in to my day rather than my day into my healthcare. So I just try to work around it rather than having my life work around my healthcare.
Do you think that
Mm-hmm. I was always given a lot of responsibility in terms of my healthcare. So today I still take a lot of responsibility with my healthcare. A good example of that is after I developed diabetes after my first year in college. I learned about that all by myself and maintained that all by myself. My mom has absolutely no clue about what it takes to maintain that, and consequently she doesn't bother me about it. So that's probably another tip. You could just let them do it all by themselves from day one. But So
you would say that it has been really beneficial for you in the way that at an early age
mm-hmm.
you were encouraged to do that?
Yeah, I was encouraged to do things for myself at an early age and am now, and so that I think that will help me along in the future as well. And I'm not going to be able to call for help when I run into a problem. I have to figure it out by myself. And I always have, especially when I went off to college. You didn't have people around to ask about what to do, so you have to try to figure it out for yourself in the best way possible.
The next section will discuss how to use healthcare skills development to complement educational and vocational goals in IHPs, 504s, and IEPs. Recall the 8 steps of the transition process. The first 2 steps pertain to assessment. The remaining 6 steps are integral items to address in the transition plan. IDEA defines transition services as a coordinated set of activities for a child designed within a results-oriented process that is focused on improving the academic and functional achievement of the child with a disability to facilitate the child's movement from school to post-school activities. Major life activities addressed in Section 504 have an impact on both the healthcare transition and the overall transition to adulthood. Accessing healthcare is both a functional skill and a critical component of independent living. Services that improve an adolescent's ability to manage their own healthcare must be part of 504 plans. The IHP itself is a plan to address health needs. Many schools use the IHP to develop health skills, such as medication management. Consider specific healthcare transition activities based on ages and stages when identifying areas to address in the IHP. Use the track results to determine which skills the child has yet to attain. Discuss the results with the student and parent to identify their priorities among these skills. What does the student need to develop a particular skill? The planning guide worksheets support this step and identify individual student needs. These might include modeling, coaching, or practice. The transition plan is the fourth worksheet with dedicated areas to write out student plans matched to the assessment worksheet. Recall that for early and middle adolescents, the transition plan is a parent worksheet. For late adolescents, it moves to the student worksheets. Plans will vary for individuals but should be task-based. Establish a timeline that builds gradual independence in all of the student's medical tasks. If the planning guide reveals that the student has many areas that require goals, choose the most important 2 or 3 areas rather than making a goal for every area. Healthcare skills development fits in with the IEP transition plan in the following sections: education and training, employment, independent living, programs and services. In a 504 plan, healthcare skills fit in with the accommodation plan on page 1 and with the plan and placement section on page 3. Insert healthcare transition skill development goals into the other goals you include in the plan. Later in this presentation, we will discuss student tools and activities for use while carrying out the plan. Working with the student's primary care providers, specialists, CMS nurse, and other healthcare providers will increase the student's skills in multiple areas. Follow up with the student and family as you would for any other IHP 504 or IEP activities. Complete reassessments annually with each new plan to encourage the student's progress through the healthcare transition stages. Celebrate newly mastered skills and make new goals for the coming year. How do steps 1 through 5 match the IEP process? The Section 504 process? IHPs? Take a moment to consider these questions. The presentation will automatically resume in 1 minute. Now that you are familiar with all of the available tools, let's identify potential activities and tasks for students' transition plans. In this section, we will focus on activities for steps 3 through 7 in the transition process. Addressing healthcare transition in your work reinforces your message that the adolescent is increasingly autonomous and has the responsibility for monitoring and managing his or her health in real-world settings. Skills used in healthcare transition, including planning, self-determination, and communication, are similar to the skills that you cultivate with students for work, independence, and other aspects of community living. Further, schools are a practical, comfortable, natural learning environment where a number of different individuals are available to support the adolescent. Explaining the necessity of routine medical tests is one potential activity for the student's healthcare transition plan. This skill supports communication with multiple providers or insurance companies. Students who will ultimately manage personal attendance for daily tasks should rehearse directing others, such as school aides. This develops the student's ability to describe their needs and provide correct instructions. The Center for Independent Living in your area is an excellent resource for training. Medication management is a very important skill set for self-management. Different skills from this set are appropriate for different healthcare transition stages. These activities also transfer to other areas of transition. It is important for students who use medical equipment to become responsible for its use, care, maintenance, and ordering. This activity could eventually include obtaining insurance approval for new equipment. Interacting with healthcare providers is a specialized social skill to practice and master prior to the student's care transfer. Adding different tasks for the student's one-on-one time with the primary care provider into the healthcare transition plan teaches the student different aspects of managing a doctor's visit. One way to record medical information and simultaneously instill responsibility is to have students keep a medical journal. Templates are available from a variety of commercial and non-commercial sources. It is also simple to make a medical journal with a 3-ring binder and dividing tabs. The 2-page Healthcare Transition Summary from FloridaHATs is one example of a medical journal. Students may prefer e-summaries to a paper medical journal. Electronic tools allow for increased independence and privacy during middle and late adolescence. Potential tools include patient portals in the physician's electronic medical record, simple functions in the student's cell phone, such as their contact list, the note page, the alarm, and reminders, or downloadable applications. This is one area that may allow teenagers to quickly master specific tasks within the overall activity and gain confidence. My Medical keeps track of test results, stores medical histories, and monitors chronic conditions. It works with iPhones, iPads, and Android phones. My Med Schedule sends emails or text reminders when it is time to take medications or get a refill. Originally designed for post-transplant patients, it does not require a smartphone. Think of the tasks you use in transition plans that address employment or independent living. Making phone calls to follow up on job interviews, requesting reasonable accommodations from an employer, or filling out employment forms. Each of these activities is a transferable skill with an analog in healthcare. Calling a pharmacy to refill a prescription, describing health history to a new provider, or filling out insurance forms at a doctor's appointment. How do these skills compare to those you typically include in transition plans? Take a moment to consider this question. The presentation will automatically resume in 1 minute. The FloridaHATs student self-management booklets are excellent tools to foster independent skills that are also developmentally appropriate. Like the planning guides, there are 3 self-management booklets separated by the transition stages. Each booklet provides age-appropriate preparation activities for youth to complete independently. The first booklet, Since You're Not a Kid Anymore, emphasizes the link between healthcare skills and independence. By highlighting growth from elementary school to middle school, this guide encourages the student to think about the future. This booklet targets students in middle school. The second Patient Self-Management booklet reinforces the youth's self-efficacy during middle adolescence. The last booklet has a slightly different format to highlight the major life changes that begin at age 18. Each booklet provides material for youth with special healthcare needs, a section with healthcare terms and definitions, and ideas for staying healthy. The self-management booklets focus on the youth's increasing responsibility throughout the healthcare transition stages. Booklet activities encourage the student to prepare for a situation before it arises. The material instills confidence that the student will master new skills. My Healthcare is a free instructional resource for transition-age students with intellectual or developmental disabilities. It focuses on improved communication with healthcare providers, the use of adaptive tools, and development of self-advocacy skills. It encompasses approximately 22 hours of classroom instruction, incorporating modeling, games, and role-play activities throughout the course. An instructor's guide and training video provides step-by-step guidance that corresponds to learner materials. It also offers guidance in integrating Florida access points for English language arts and health education in teaching and learning. The instructor's guide includes formative assessment rubrics to aid learning among students at every performance level. The curriculum uses the GLAD teaching model for students with intellectual or developmental disabilities. GLAD serves as a reminder about important skills to use when communicating with healthcare providers and others. What's Health Got to Do with Transition is another curriculum sponsored by the Florida Developmental Disabilities Council, developed in partnership with the School District of Hillsborough County. What's Healthcare Got to Do with Transition addresses a broad range of issues concerning movement from child systems to adult systems. It is appropriate for both exceptional student education and general education students in grades 9 through 12. It addresses self-advocacy, decision-making and self-management skills, rights and responsibilities when turning 18, staying safe physically and emotionally, and maintaining sexual health. Remember Joe from the last presentation? He is the 19-year-old student with seizure disorder and some intellectual disabilities. His mother provides most of the day-to-day condition management, which leads her to believe Joe's IEP goals and independent living are unachievable. What healthcare transition goals could go into Joe's IEP to ensure independence? Perhaps in early adolescence, Joe could have learned to set up medication reminders and his weekly pill box. In middle adolescence, he could have met with his doctor to discuss the effects of alcohol on his seizures and prepared for social situations that might include alcohol. In the age of transition, Joe could have selected a mentor to guide him through financial decisions so that he could have selected his own apartment. These are just a few ways that the healthcare transition could have integrated with his IEP through the years. How about Jane from Module 6? Recall that she is a 16-year-old student with diabetes who hopes to attend college in California. Her parents are afraid that she will not be able to manage her health and want her to stay home. What healthcare transition activities could be part of her 504 plan? Jane could have started learning about her insulin pump the first year she had it, when she was 13, and gradually taken over its maintenance. Managing snacks and physical activity could have been a 504 activity in middle adolescence. Now that she is 16, one goal might be to attend an out-of-town marching band competition without her parents. Here are additional resources for student skill building. My Healthcare is the curriculum for students with intellectual and developmental disabilities. The Institute for Child Health Policy has developed a variety of healthcare transition booklets, guides, videos, and other resource materials. The Florida Department of Education offers a number of services and resources for addressing the secondary transition in IEPs. The Florida Centers for Independent Living website offers an interactive map to locate nearby offices. Search using the map or by county. Project 10 assists Florida schools in improving secondary transition services to students with disabilities and their post-school outcomes. The Illinois Transition Care Project created a presentation for students, parents, and caregivers entitled Health Goals and IEPs. It is an in-depth presentation on working with the IEP team on building healthcare skills through the Education Transition Plan. Create a transition plan with students to address 1 to 3 skills. Tailor the plan's tools and activities to individual student needs. Update the plan and its activities annually when you complete reassessment. Use the links from this course's toolkit to access the tools from this module. This module's activities are relevant throughout the transition process. In the next module, we will focus on bringing these skills together to manage a key task, the care transfer.